Okay, let's go for it. So Gweno, I think you're helping me drive the slides. That's fantastic. So my name is Dominique Allwood. I am a consultant in public health medicine, and I'm also Assistant Director of Improvement at the Health Foundation, where I've been supporting the development and the launch of the Healthcare Health Anchor Learning Network. And I also have a role out in the NHS where I help support some of our work in anchor institutions with the NHS and local partners in Northwest London. I'm delighted to have the following guests joining me. You can see their pictures on the screen and along the panel box. We've got Erickajoy, David and Joyce. So I'm going to ask to introduce themselves in a moment, but I really hope that this is going to be a thought-provoking, inspiring 90 minutes, and we've really given us a good chunk of time to hear from some absolute experts in the work that they're doing around anchor institutions in the States. So let me hand over to Erickajoy. Could you just briefly say a little introduction about yourself?
Sure. So glad to be here. My name is Erickajoy Daniels. I'm the Chief Diversity, Equity, and Inclusion Officer for a health system in states called Advocate Aurora Healthcare. So we are spanned across 2 states, Wisconsin and Illinois. And I have the honor of being in a position it's less about the position, but more about the responsibility of driving and advancing health equity and diversity and inclusion for over 75,000 team members and million-plus patients. So excited to be here with the group today.
Thank you. Wow, what a huge population group you work with and for, and wonderful to hear someone that probably has more job titles than me. So thank you, Erickajoy. Fantastic. David, over to you.
Yes, good afternoon, everyone. It is morning and cold in Chicago. I'm David Ansell. I'm a physician, a general internist, and I'm the Chief Health Equity Officer at Rush University Medical Center, leading a team or part of a team that's really driving our health equity efforts, not only within our own system, but across the neighborhoods where our hospitals and clinics serve.
Wonderful. Thank you, David. And I know your story and your anecdote about changing from a role of Chief Medical Officer to Chief Equity Officer. And I think that's absolutely fantastic. And perhaps CEO needs to take a slightly different acronym now in the UK, thinking about that. So thank you. That's fantastic. And Joyce, last but by no means least, hello.
Hi, good afternoon, everyone. My name is Joyce Huang from Cleveland, Ohio. And I'm the Vice President of Community Development at MidTown Cleveland, which is a small community development corporation. So I am not necessarily within a health institution or an anchor institution, but by training, I'm an urban planner. And so we've been doing a lot of place-based work with our anchors, which I'm happy to share more about later on.
Great, thanks. Wonderful to have you with us, Joyce. And I love the placemaking, placekeeping concepts that are in your bio. And in fact, everyone's got some wonderful art in the background. So I'm really looking forward to a creative session. Gweno, can I have the slides back up? I'm going to do a quick housekeeping and then we're going to get into the meat of it. And I've just seen someone popping in the Q&A that they've got no sound. I'm hoping that that's resolved itself, panic over, so that's fantastic. So just to let you all know, we're recording the session so that for your colleagues who can't make it, you'll be able to hopefully share this on with them. So please just remember that. I'm really keen that we have a really transparent conversation, and so we've made the chat and the Q&A all open throughout the session, and there's only one rule, and I'm just hoping you can stick to a little bit of meeting hygiene for us, which is we absolutely want you to be reflecting, sharing any links, resources, ideas, comments, or indeed examples of your own work through the session, but please use the chat function for that, and then any specific questions for the panel, please pop into the Q&A. It just helps us manage both of those streams, and I've got a couple of people on hand to be helping with that. And that prompts me to also just say thank you to Gweno, Julia, and other colleagues who have been helping us set up this session and have done a fantastic job with all the organisation. So please do use the chat. We want this to feel like a really community interactive session as far as it can be on Zoom with no cameras or voices in the room, but please try and help us make it feel interactive if you can. So if you fancy introducing yourself, you can do that on the chat too. Okay, Gweno, next slide, please. So for those who are slightly newer into the concept, we recognise there's people that are coming from a range of different backgrounds with quite a lot of experience, and some who are dipping the toe in the water, so to speak. Just a really quick recap about anchors. So generally they are public sector, but usually large organizations that are rooted in their place and connected to their community. So they have a real sense of purpose and mission that is related to that community. They can be a range of different types of organizations, and indeed in our network we have a number of people from different backgrounds and organizations, but often and usually they are places like healthcare institutions, so hospitals, universities, housing associations, cultural institutions, and potentially municipal organisations like local government. They are often the biggest employer or the biggest purchaser in their area, so they have a significant set of assets with which they interact with their communities. And this is really thinking about how they might become more conscious and intentional about what they're doing with their operations and their practice to benefit the health, well-being and wealth of their local communities. And for this particular session, we're looking at the lens of ethnicity, race, racism and racial inequality. And I just want to be specific about that language. It's something David has taught me about before, which is that we are thinking very much about things that we want to tackle and address. And when we use language such as disparity, we're often talking about difference, which doesn't quite qualify the sense of actually needing to do something about this. It's not just about difference, it's actually about inequality, unequal and unfair. And I think as you listen to the speakers, whilst their context may feel different because they are over in the States and the way their healthcare and society is arranged in some ways is quite different to us, they will have very similar challenges and things that they've been tackling, but the language that they're using, I think, is very intentional and purposeful, and we need to be thinking about how we make that very strong and a core message of the work that we're doing. So do listen out for the language and the fluency in which they're talking about this, because for many of us, we find leaders find it difficult to talk about racism, structural racism, institutional racism. And today of all days, it feels particularly poignant to be talking about this work because it's Stephen Lawrence Day, and I'll come back to that in just a moment. So just to finish off thinking about the slides, Weno, anything else I need to say? I think it was just about strategies that anchors can think about. So using that lens of inequality and particularly race and ethnicity and the difference we see and the unfair and unjust differences that we see in the outcomes and the access and the context, how can anchors think more about how they purchase, think about the quality of the work and the access to work that they provide as employers, the buildings and estate they have, the development of those and the use of those, the way in which they interact and impact the environment, and how they work closely with their partners. And you'll hear our speakers talking across a number of these different strategies that they are focusing on around racial inequalities. Well, no, I think that's it for the slides for me. Is it perfect? So just back to sort of the poignancy of the day and really important to think about why we're here. So many of you will remember Stephen Lawrence was a teenager who was murdered in a racist attack around 17 years ago, and there were a number of failings with the police and a large inquiry that found the Metropolitan Police were very much found to be institutionally racist, and that was a term the first time really it became prominent in the UK. And since then, a number of people have campaigned, including his mother, Baroness Lawrence, who's talked about the importance of tackling racism. And this quote for me is really important, I think really frames this session, which she says is, "The recent events of George Floyd, the resurgence of the Black Lives Matter and societal inequalities exposed and exacerbated during COVID really require us to reflect and change the way in which we're engaging and working with our local communities. And this terrible yet historic time really provides an impetus for that." So this really sets the scene. So why we're talking about this today, and to have such amazing speakers with us is fantastic, and really grateful for all the participants being on the line. So I'm going to kick off by handing over to Erickajoy first, and she's going to give us just up to 10 minutes kind of conversation piece about how her work touches on this and what she's doing, and then the other speakers will follow the same format, and we'll see how many questions we get in between as to whether we pause or run this fairly rapidly and then get into the Q&A. But so please feel free to post questions and chat and reflections. Erickajoy, over to you.
Thank you so much, Dominique. As I mentioned, excited to be a part. It takes me back to my days of traveling. My background's a little eclectic. I started in military research, went from that to prison. I worked there, I did not live there. but I worked for the Federal Bureau of Prisons. Then I went to manufacturing, and then I got recruited into healthcare. As you can see, I don't mind change. In fact, I love being in new places to build things, to connect the dots and find strategic opportunities for synergy and impact. By trade, by my background is actually industrial psychology, and I'm an organizational development kind of gal. I remember my days of going to Banbury often for the work that I did for a manufacturing company. And I say all that to say that agility, awareness, and curiosity are the core, the heart of what we do. If I think back to where our journey started for Advocate Aurora, it really started within two legacy systems that came together in a merger. And fortunately, both had an intention around driving. At the time, it was just diversity and inclusion. We were looking at difference. We were looking at the environment where difference can thrive and understanding in a clear way what was our responsibility as an organization to ensure that for our team members, for our patients, and for our communities. And that weight of that responsibility, to me, is the parallel weight of responsibility of what comes with being an anchor. You know, Dominique, even as you were crafting out the definition of the anchor, I saw it as really, you know, for leaders in this space, I saw it as my personal responsibility, right? I saw myself thinking, how do I see that I'm rooted in place? How do I see that I'm connected in my community? Because that insight through connection totally informs strategies and ideas and direction for where you can go. When I think about the assets of my team, the assets of my own thinking, of my own lived experience to bring into this work. And I think that's so important for all of us to consider. What do you bring as an anchor in the anchor? And then finally, consciously using all those resources to benefit our communities. And our communities aren't just those outside of our walls. Our employees, our team members, associates, however we label them, they are a community. Our patients, they are a community. Those who have not yet chosen for them to trust us with their healthcare, they're yet another community. Our stakeholders, potential collaborators, they're all communities. And even as I share that, that's what has framed our work at Advocate Aurora and the strategy and plan. I want to just offer maybe 3 key things to think about as you dive into this work. One is data. Data is going to be your anchor. Data is going to be your direction, because there are things that the data will show you that you'll discover that you thought, that was kind of my gut feeling anyway. But the data enables you to have solid information, solid articulation to those who aren't too sure if this is really the right way to go. I love it that I'm in the call with the UK, because shamelessly, can I steal something that I used to always hold on to when I would visit the UK and come back? Is particularly when I got into the work around diversity, I'll never forget riding the tube and seeing the sign to say, mind the gap. And I would tell them here, we have to mind the gap. We have to pay attention, because the gap is actually a place of risk and insecurity. And if we don't mind it for others who are trusting us to get them on the journey, to get on the tube and get to their destinations, then we're not fully doing our job. Particularly in healthcare, we're not doing our job at helping people have the best lives they can. So data helps us to get there. Data shows the gap to mind. And then design, being creative and agile in a place where we can get the best designs that are informed by our patients. We on the inside can never identify what we all think is best for people. People inform us of what's best for them. And doing that together leads to better outcomes. And then finally, I would say, but it has to be a determination. You can build the greatest strategies and best practices and drop them in your organization and wonder why they're not working, because the culture has to be there for them to thrive. The environment has to be there for them to be fluid. And there has to be a learning mindset and a continuous improvement approach of making these things happen. Some of the things we have to remember too is the pace of the game. I once saw a quote that said, "Those who agree with us bring us comfort, and those who disagree with us bring us growth." And sometimes, particularly in time we in, Dominique, I couldn't think of a better fortuitous day for this to be the day of remembering Stephen Lawrence. And then just this week here in the States, us understanding this verdict from this case around George Floyd. And the same hour, I don't know if you all are aware, but in the same hour that the George Floyd verdict came out for Chauvin's case, there was yet another shooting. So there continue to be these instances where we don't have all the answers, but as anchors, we should be asking the right questions and finding that right determination. And people won't always agree with the work we're trying to push to do. They won't always think it's the priority. They won't always have the same passion as us, but that determination will enable us to get there. So I think this time will be a great opportunity for us to explore that, whatever curiosities the group has so that we can raise those and discover together. This is the safe place to start some of that journey. Think of it like the beginning of a race, right? You know, the runners, they stretch their legs and they squat and they get ready. Like, let's do that together so that we can be built to run this thing. So thank you.
Wonderful. Erickajoy, that was a fantastic opener. You've really set the scene so well, and really brought your passion across about why you're in this, and we'll get into more of the detail about some of the things that you do. But I love the things that you're saying. The key messages about data and design are hugely important, and understanding your community is all around you. But stealing our mind the gap, what a fantastic thing to think about. And the analogy you've made about it's a place of risk and security. We need to get others over that gap to help them on their journey. A fantastic metaphor. So thank you so much. Please do pop questions into the chat and reflections in the chat. What I'm going to do is move straight on to David, because I can tell we're going to have some great scene setting things. I think that the real joy and quality will be getting into the questions. I can see Erickajoy is desperate to answer some questions soon, so that's fantastic. David, over to you.
Good afternoon, everyone. Thank you for having me, Dominique panel. I get to work with Erickajoy here in the States on some of the national work around in the healthcare anchor network that we're in. And thank you, Erickajoy. Just always inspiring. You know, all of this starts with story in a sense, and we're all connected through stories. I'm going to tell you my story. So my parents were immigrants from England to the United States. So I'm like so connected to all my cousins are in London, and so I go back. Before the pandemic, I was going back 3 times a year. So it's kind of my second home. I view that. In 1938, my grandfather, who had escaped Poland with my grandmother, the only 2 in their family to get out, went back to Poland to get my grandmother's father out of Poland. And he refused to come to England. Of course, the Nazis was rising. And the story of my family in Europe was one of it was one of racism, mass incarceration, and genocide. And my grandfather, my great-grandfather, my mother's grandfather, we got a picture of him through the archives of a Nazi soldier who posed them in front of tombstones, and got it just before my mother died a couple of years ago. So my parents came to this country after their families were wiped out in the Holocaust, and then I grew up here. And as a young boy, I grew up during the civil rights movement in this country. I couldn't help but see the connections, but but I didn't understand what whiteness meant. For me, and I became a doctor. I came to Chicago to work. I met this picture on my desk, Windora. I met her during my internship. She's my patient. She became my friend. We both migrated to Chicago, me from Binghamton, she from Birmingham. We live literally 2 miles away. She's still my patient today. But as a doctor, I couldn't understand the galloping impact of diabetes and hypertension in her body and how to understand. And she said to me one day, the worst thing that would happen to me would be if I had a stroke and I couldn't talk. And one day I got called literally from where I'm sitting now to my office, which is 1 floor below. She was in my office and she had a stroke. And I'm going there and say, how did you get here? And she said, David brought me, which is my name. It was Darnell, her boyfriend. And she had a stroke, the best stroke team in the world at Rush. And we couldn't keep her from save her. And she's speechless now, but full of love and joy and everything. But it was my observation as a doctor taking care of people who were poor that made me really wonder if we had it all wrong. I got recruited to Rush, which is an academic medical center in Chicago, to be the inaugural chief medical officer. And when I asked the CEO, what's our purpose? He said it's to be the best in healthcare. And Rush is ranked among the top in the United States in quality. And I led us to the top of that mountain. We could plant that quality flag. But I had these doubts. And I began to ask myself, what if we had it all wrong? Because I kept thinking about Windora and my other patients who I'd seen. And there was something happening to them that could not be explained by the way we delivered care. And I like what Erickajoy said about curiosity. You know, you ask questions, you ask why, the question why 5 times. For those of you in quality and safety, you ultimately come to the root cause of the problem. And I began to think, here I was chief medical officer. First of all, you're chief medical officer, you're top in quality, you get there, you don't quit that job. But I quit. And the reason I quit is because I didn't feel we were asking the right questions. And I led a community health needs assessment work. I'm a social epidemiologist on top of being a doctor. And we presented it to our board, and we changed our mission from being the best in healthcare to improving the health of the individuals and the diverse communities we serve, with the communities being new. And then you began to say, well, why are people, and we showed the life expectancy gap. People hear about it all the time now. 5 years ago in 2016, it wasn't so common. We said, if you live downtown Chicago, you could live to be 85, 90 years old, but you live 2 stops past Rush on the blue line, life expectancy is under 69 years old. Some neighbors under 65 years old, up to a 25-year gap. And when you begin to ask why, we presented to our board, I had to make sure it didn't keep getting written out of the report, that the root cause was structural racism and economic deprivation, not the only things. And those were the words that went in our report, not poverty, which is a state, but economic deprivation, which is an affliction. And we named them as afflictions, social conditions that were afflictions, and that we as an organization had an obligation. I just want to talk about the person, so naming the problem right. Now, we know in patient safety or quality that if something goes wrong in a hospital and someone is harmed, a child is harmed, or anyone is harmed, you have to do a root cause analysis. And the reason you do a root cause analysis, because if you don't identify the root cause, by the way, there's oftentimes more than one, usually takes 8 things to go wrong. So I don't want to just say it's just one thing, but if you don't name the root cause, how can you ever fix it? They're named without prejudice. And so naming racism and naming economic deprivation without prejudice was critical. I just want to say, as a personal story for me, I was uncomfortable as a white man naming racism. And I had to do a root cause analysis of myself. Why 5 times? Here it was, all of my relatives were murdered, genocide. You know, I had the family experience. I came to Chicago to take care of people. All of my patients, without an exception, are Black and brown patients. You know, I knew this, but why wouldn't I say racism? Why wouldn't I name it? And when it comes down to it, and you ask why 5 towns, because people invited me into their rooms. I was in rooms with people who were like me. And it became critically important for those of us who are white or assigned white to name the root causes, or rich or assigned to richness, wealth, to name these root causes. Once you've sort of said, what's the problem? What are the root causes? Now you get into solutions. And I know we're going to spend some more time on this in a little bit, but we began to say, and back to Erickajoy saying, how do you now build the solutions? I think it's critically important to name these root causes, not to blame, not to judge, but just to be very, very clear that we're up against systems of affliction and oppression that are deeply designed into our societies, oftentimes without a perpetrator. I like to say, I'm in Chicago, the stormers of the Capitol, overt white supremacism doesn't seem to be here, except the systems are perpetuated. Our work is to redesign those systems with intentionality, with curiosity, with hope, and leveraging our personal leadership with our organizational leadership capital in all its forms, human, social, organizational, and real capital, to improve the conditions under which people live, work, and play. and then how power needs to be shared along the way. I'm going to end on this note. Humility in this journey and partnering with the community means nothing about us without us. And subordinate ourselves to the need of our communities, whether it be outside our institution or our employees who are part of those same suffering communities. So thank you.
David, wonderful. I mean, Erickajoy is a hard act to follow, but you absolutely did that. And we will be hearing a lot more about the specifics, as you say, about getting into the solutions. But I don't think we can spend enough time on naming the problem and thinking about why people find it difficult to talk about what we're really trying to tackle here. And I mean, you talked about, are we asking the right question? Did I have it all wrong? What were we actually in the business of healthcare to be doing? Not just improving healthcare, but actually thinking much more about health. And I think the language and pieces that you picked up around that is so important, and the intentionality. And thank you for your honesty there. So we'll definitely come back to solutions. We'll come back to specifics around data, etc. But this really is important to think about the leadership journey and the language and what we're really trying to do. This is cultural problems and big challenges we're trying to address. So on that note, Joyce, over to you. Great to hear from you. Tell us a bit about you and your work.
Absolutely. Thank you. Thank you. So tough acts to follow, but I really believe that Erickajoy and David really gave the language to set the tone for what I would love to share with you all. And so, for me, I grew up in upstate New York, have spent my life around the Great Lakes region. So went to university near Detroit, and then now I'm in Cleveland, and these post-industrial cities. And I had the opportunity as a young person to travel to many different cities in the US, Philadelphia, DC, Chicago, and it's quite amazing actually that the fact that the patterns of development and the patterns of place are very similar across these cities when it comes to race. And that's partly what David is referring to around sort of the systems of inequality and systems of inequity that are tools to keep people in the state of economic, the affliction. And so to start, I would just like to share a map, because as an urban planner, I have to share a map. It's just with regards to our neighborhood, we let's see if I can share it. We had this increase in development over the past few years. And so let me just full screen this.
Yeah, we can see, I think we can see that, Joyce.
Okay, wonderful, that's perfect. And so
yeah.
As you look at this map, you'll see this is the east side of Cleveland. And along the blue, you'll see all of the different anchor institutions that are pretty much in these two centers of employment, one in downtown Cleveland and then one in University Circle, which is where University Hospitals is, Cleveland Clinic, which is a globally renowned hospital. And this map used to really excite us because we said, wow, our neighborhood is located right in the middle of all of this. We're right here in the middle. And think of the possibilities of all these institutions coming together. However, what you don't necessarily see in this map is located in sort of the voided areas here. So if you look at the areas north and to the south of this blue area, these are actually areas that people, when they think of Cleveland, kind of want to try to ignore, unfortunately. And part of it is that these are the neighborhoods where the Black communities that came to Cleveland were segregated into. And these are the areas where redlining policies that did not allow for Black community members to enter into home ownership. These are the neighborhoods where there has been perpetual disinvestment for generations. And what I wanted to bring up for our time together is the impact of infrastructure and the impact of development patterns on how this impacts health. So as David mentioned, it's very similar in Cleveland. In the Huff neighborhood to the north of us, the life expectancy is 59 years old. And then just a few miles away, it's in the 80s. And then, very disheartening, the infant mortality rates and maternal mortality rates in the neighborhood to the north of us is probably one of the worst in the nation. And yet some of the best children's hospitals are just a step away. And what we started to see was that these roads basically became highways that divided the neighborhoods together. So, it's very hard to create access from a place-based perspective, and institutionally, it was very hard to navigate within the walls of large hospitals and large universities. And so what we started to see was for our community to really push into these inequities by saying, A, how do we address the development patterns so that there can be more access? One of the anchor institutions, university hospitals, actually decamped their women and children's clinic. So they moved it outside of this university circle area into our neighborhood, right in the middle, accessible by public transit and accessible north and south, just to address the infant mortality and maternal mortality rates, specifically within our Black communities. The other thing we started to really push on was we need to see more of these institutions decamping. And so we are creating a innovation district right in the middle that will bring economic opportunities to the north and to the south. And then finally, internally within our own organization, we really had to, we basically took a look at our own policies and practices and did an audit of how we, approached development and real estate. And we did our own real estate analysis to say, we actually are not including community members in that specific practice. How can we begin to integrate them in more? And by moving racial equity into the center of our organization, that really started to change how we looked at it. We ended up adopting.
I think you're dropping slightly in and out. I hope it's not at your end, but I was hoping it might be at my end, but I think you may be just having a slight connection issue there, Joyce. Can you still hear us?
I can hear you. Can you hear me?
Oh, okay. You've frozen a little bit, but that's okay. Yeah, we can hear you now. Go for it.
Okay, I will keep going.
Please do.
I apologize for the connectivity issues. And so kind of going back, so our organization adopted our own statement on racial equity so that community members can hold us accountable. We also wrote a racial equity statement for the developers that are working within our as we develop this innovation community and develop the buildings and develop the programs to invite community members and to say, this is also for you. And whether it's having your own real estate investment in the property so that there's more financial gain for residents who have lived here for generations, or just access to more technology and health. These are all things that we wanted to really integrate into our work. And so, doing that root cause analysis for every organization is something that we are really trying to encourage and push within our neighborhood, just so we are all asking the right questions and addressing these somewhat invisible systems that perpetuate inequities. So I will pause there.
Fantastic, Joyce. And we'll come back to the specifics. You got us into some real tangible details talking about the statement on racial inequalities that you made and some of the audits of policies and practice. And I know some of our audience will be very interested in some of those specific types of activity that they might be able to employ within their own anchor institutions, and a really poignant illustration of some of those differences that we see in across the map that really speak to inequality around life expectancy. And I know that David's talked in the past very much about how it's an absolute travesty that we'll see life expectancy of Japan next to life expectancy of Bangladesh, with these institutions that are some of the world-class, world-leading institutions, and such poor outcomes on the doorstep. So we'll come back to specifics in a moment. I'm just going to have a quick look through the Q&A and make sure we haven't missed anything on the chat as well. So just in reverse order, let's just take this as a question for the audience to be thinking about. And if you want to chat in on the messaging, that would be really helpful. But in the UK, colleagues, have you seen examples of where anchors are working specifically to tackle racial inequity? Do you have any examples that you can mention, any links or any organisations that you know? Please feel free to start popping those in the chat for people to kind of benefit from. So the first one really I'm going to come to was about data, and there's a question about the type of data that you might collect on racial inequalities within organizations. And I think there's an interesting paradox here, because what we're trying to talk about is really understanding people's context and their narrative. So we talk about the biology and the biography, but actually we need hard data to show us those gaps and to look at where we need to target our actions. So I'm going to come to you, Erickajoy, first. Can you talk about some of the types of data that you collect that relate to this area that help us understand either the problem or the impact that these strategies are having?
Yeah. So the first step we took was one, challenging ourselves on when they asked, well, what new D&I measures do you want to track? And I said, what do we already track as an organization? Like Dave was like, what do we already look at from a sense of quality? Readmissions and a length of stay and health outcomes. Let's just start to stratify those by dimensions of diversity. Because if we keep looking at things from a macro level and not a micro level, we'll never really understand where the true opportunity is. So I think the first thing is there are already things that are important to us that we are reviewing. Let's make sure that they are also revealing for us. So you've got the quantitative data, but then we also challenge ourselves to look at the qualitative side of things. And I loved it when you talked about get to the root, right? We had to do RCA around what was showing such a difference in hypertension for African-American males in this geography, in this zip code. So doing that kind of laser focus enabled us to do that. And then broadening out, when you sit on the qualitative side, the listening to our patients more. What forums do we have to hear them? And they were limited. And so we had to expand our opportunities to how we listen, how we ask, and what were we specifically asking. That for our attributed patient populations, and then the power of the CHNAs, our community health needs assessments, gave us that intel of understanding what that looked like so that our hospital could take ownership within their local geography of driving action through new strategies.
Great, fantastic. And just, I guess on the specifics of data, you've talked about some really important clinical and operational metrics that many organizations collect. So the first point should absolutely be start there and look at differences and drill down by different population groups. And you talked about your community health needs assessment. Are there wider metrics that don't just relate to service provision that you were looking at as well?
Yes, that's when we start to get into our social determinants of health. Which I think, Dr. Ansell was driving at when we understanding what are some of those gaps around, food security, housing, transportation issues, and safety. And knowing that we can't shirk the responsibility because those areas aren't our ownership in healthcare. But again, if we're an anchor and we're tied, some of our assets mean what partnerships can we employ and can make connections with other stakeholders in the community who can help drive change in those spaces.
Wonderful. So good segue over to David. David, tell us a bit more about the types of data that you were collecting. You're a measurement man, I know this, and you're about QI, so you'll be all over the data. Tell us a bit more.
Well, as we launched this as a strategy 5 years ago, so I wanted to just make a point. This cannot just be an add-on to all the work you're doing and think you're going to have the change that you need. We're talking about hundreds of years of systems in place, oftentimes, without that identified perpetrator. So so it's critically important if you're going to take on this work to make it strategic. So because everything follows from strategy deployment. So we made this a strategy back in 2016. And then when we thought about the strategy, we said, well, there's a inside part of the strategy, and then there's an outside part of the strategy, and they link. So let me talk about the outside first. In the United States, because of our crazy healthcare system, the Affordable Care Act, President Obama, you may remember, required that not-for-profit hospitals do community health needs assessments for the first time. And you have to do a couple of things. You have to name what were your community or communities around each of your hospitals, and then look into the data and identify the cause of death. That led to our RL map, the train map. You've got the Mind the Gap, the tube map in London. But it also required us to look in, not just the root causes I mentioned before, but what were people dying from? So everyone was thinking Chicago, West Side, it must be gun violence. And that was number 1 and 2, cardiometabolic disease and cancer. And so we needed to rechange, the data was important, so we rechanged the narrative of these neighborhoods as being from hopeless to hopeful, from neighborhoods of liability to neighborhoods full of assets, right? It allowed us to rename, but it forced us also to go out and listen, do listening tours of the neighborhood. And we met with some suspicion, not hostility, but suspicion, but listening to what people wanted and needed. And what they told us were, we want jobs, we want you to support our local businesses, and so that we want help for our children. So they told us exactly what they needed. So that's the outside part of it. And that helped define what we were going to do and what we were going to measure. Hiring and building into careers, purchasing and support of local business, taking money and out of endowment and investing it in the community, co-locating behavioral health services and other things in the community, doing programs for children. You know, what they said became part of our implementation plan. So it wasn't just us sitting in a room thinking about the data. That's the outside part. The inside part is, what about our people and our patients? The most important thing we did internally was name our employees our first community, and did a listening tour inside. We laid them out along their financial distress along the same L tracks. So using data from we could figure out, so you can take money out of your pension in the United States for very extreme reasons, like eviction, you know, or you're homeless or something. And so we tracked financial distress along those same train tracks and found that in the lowest life expectancy neighborhood, our employees, largely Black and brown women, 1 out of 5 was experiencing extreme financial distress and coming into work every day. And this was not some strange abstract idea. These are people you work with every day. And that made our focus on our employees and their financial health and their wealth building and their health central to this. But then we also looked at our patients, but then we looked at our leadership structures, our board composition, our policies and procedures. So all of these have data elements associated with it and provide the infrastructure for change, just like any quality improvement work, you know, an organization has done in the past.
Fantastic. Thank you. Really helpful and very specific examples. And Joyce, I'll come to you in a minute, but just back to Erickajoy, because you've got a particular area of skill set and expertise around the workforce. And we often wait for some big national data surveys to come out to ask our workforce about impacts of their employment conditions and circumstance, etc. And I don't think we spend enough time in many of our institutions speaking to our workforce and understanding these issues. So Erickajoy, tell us a little bit more about the types of activity or data collection and the listening that you did with staff in your organizations.
Yeah, so on the quantitative side, looking at, again, what's our current approach and just drill into the stratification. So you almost identified almost like our vital signs, right? Turnover, representation numbers, time and position, engagement scores by leaders, and challenge. It was race, ethnicity, gender, and even tenure. So we also, and then we were looking at age. So looking at generations. Was there a generational difference of experience in the culture? So we got that survey data. We always know that sometimes people aren't as forthcoming in surveys or willing to engage in even taking it. So providing tools to our leaders, one was not waiting for an annual engagement survey. We started doing pulse checks. So through the course of the year, we did these pulse checks that were shorter surveys to hopefully draw increased participation. And then tools for leaders to hold more kind of listening huddles with their team. So I love David talked about, you know, the team member being the first community, listening inside the house first. That actually blossomed into, we ended up doing these things called real talks, where post the George Floyd incident last year in the spring, creating forums where people could have stronger dialogue and had candid conversations. That unearthed some things that people were sharing that spoke to the inclusion or lack of inclusion in the environment and the work teams. So leaders got to listen in and hear and understand what were the barriers. And most often they were the things that became the undiscussable issues, things people did not want to talk about or were uncertain if the organizations even wanted them to talk about or were willing to hear. And we told our leadership to say, if we've heard, we have to do something. We can't take the time to listen and then let that fall on deaf ears. So that intentionality, we're trying to keep that routine up of hearing, because you've got, your traditional models, exit interviews. I keep saying, hey, let's do stay interviews. Let's not wait till they've left to see why they departed, but let's understand if they're even thinking about it. So that more proactive approach of connecting. And here's the thing too, when we think about diversity and nuances, is that there is often, we have to address the discomfort of people have of even having those conversations across difference.
Yes.
Leaders who are not people of color, leading people of color, sometimes are unwilling or uncomfortable to entertain those conversations. So getting past that, opening that place for that dialogue to happen.
If I could just piggyback.
Please do, David. Let's make it a conversation. Go for it.
To piggyback, because Erickajoy said some pretty important things here. So one is the data collection among the employees in a systematic way, and then backing it up with this idea of pulse survey. So we're doing the same thing, and we now have questions on it. This survey we never had before. Have you ever experienced discrimination in the workplace, for example? And then we've done spontaneous things of just sort of getting feedback. So the data, so we've done some things like a call-in. So we created a racial justice action committee. When we started this work 5 years ago, and the vice president, who's actually an attorney by training, we said the hardest work was going to be inside the organization. And then when George Floyd was murdered, by the way, 3 a day in the United States, police shootings. There's not a day that doesn't go by that 3 more people, and half the time they're people of color. So there's this drumbeat of injury on a daily basis that impacts our employees. And then anti-Asian incidents in this country. Racism and white supremacism is alive and well. And we're trying to do this, racial justice work in an environment where there's continual insults. So that gathering of the employees, so imagine coming into work, what it's like to come into work every day. And then Erickajoy said, and then managing across all of the differences of gender, of age, of ethnicity, of race, of gender identity, but that has to be our intentional work around measurement. And I said, we created this racial justice action committee because we realized our leaders needed coaching and guidance on how to do this work. It's not enough. You do a survey and say, okay, if you don't know how to improve something, but if you don't, so how do you go? You can't just do unconscious bias training and feel like you have the tools, right? People need coaching and through this. And how do you build that coaching and how do you have restorative justice? Because it can't just be, we have to, respect of all the values. Respect is the most important one, because if you pause and have curiosity to respect where someone's coming from, then you get to know someone as a person. But how do you build then the tools of restorative justice? So the options are not just you be fired or you have to leave versus improving in place. So these are all, these are all important parts of the journey while we're improving patient outcomes, while we're focused on community outcomes. That the work of leadership within the organization is critical for us to move our organizations ahead.
Fantastic. Really helpful specifics there, but also talking about the importance of culture and leadership. And we'll come back to you guys in just a moment. I can see Joyce has come on again. I think sadly Joyce is having a few tech problems. So Joyce, I'll give you a moment to settle in. I'll just pick up another question or so with Erickajoy and David, and we'll come back to you. So hopefully you can hear us okay. So we've talked about the sort of the imperative and the importance, how to understand the problem better, thinking about data. There's some questions on some of the specifics now around the interventions, and we'll come back to the context and the environment and the fertile ground needed around leadership and resilience. There's lots of questions on that. I think we'll come on to that in a moment, but I'm keen to hear about what are some of the specific interventions. People saying, I want to do something about racial inequalities and I'm wanting to be an anchor institution. What should they be going to their leaders to think about, or what can they start to do every day in terms of these types of interventions? And what have you seen having some of the greatest impact? So I don't mind David or Erickajoy, whoever wants to jump in first.
I'm deferring to you, Erickajoy.
Well, I guess a few
Please
things.
feel free. Don't be.
You know,
Tell us about
one
something.
thing. Oh, go ahead. Did I cut you off, Dominique?
No.
One thing I think is important is really getting a sense of your organization's readiness for this work. There has to be clear alignment and agreement from the top of how determined and how far are we willing to go. I say that because people jump in and say, hey, we're going to do diversity work. And then you're like, okay, that means we have to challenge our policies. That means we have to re-examine our processes, pulling data and providing more visibility. And they're like, okay, so where's my first phase? And that's you'd rather know that versus jumping in and building strategies and then wondering why they're not sticky. So a clear definition around the words and what they mean for that enterprise. We started with what does diversity mean? And that may sound really rudimentary, but people were saying it meant different things for different people. Because, for example, when we first started doing assessment work, because we did an assessment to find where are areas of opportunity in our organization, where do we feel like we had the biggest need? And people said, great, we're going to do diversity work. We're going to go help poor Blacks and Hispanics. I held my breath, and I wasn't totally surprised, but their intentions didn't match the impact, right? And so, but that was their frame of reference. And reframing, like you said earlier, David, about some things about, let's redesign and let's change the narrative. Diversity means difference that matters. Otherwise, if people thought we were just doing this work for poor Blacks and Hispanics, they may not engage as much because they wouldn't see themselves as a beneficiary as such. So when we talk about how broad we mean and getting people clearly aligned with that understanding, to me, that is just an absolute critical first step. Then you can go into, okay, now we got the data, let's build. So there were specific initiatives, and I don't mind sharing some of the things that we did, but our game plan, okay, for team members, we're going to look at representation. We're going to go as far as, I think one of the questions in the chat was, how do you do things beyond words into actions? Some of that was where you can tie things to accountability. So having more clearly defined measures that become part of larger enterprise scorecards. We look at this in the same month, every month when we're looking at our health outcomes, our financial performance, our safety and our quality numbers. We are also looking at diversity and inclusion. We're tracking representation, we're tracking turnover, and the leaders are held accountable and have to answer for where there are deficiencies in their spaces. So, but you've got to make sure that whatever you build, it can't be run. David, I think you said earlier about it can't be the add-on, right? It also can't be run by a singular department. So I find where my team's responsibility is advising and being innovative and guiding them and shepherding, but the execution of the work has to happen within the organization. So leaders have to be brought into the design of those and have to be part of understanding how they're going to be held accountable.
Great, thank you. David, why don't you come in with some specifics of types of things you've been doing?
Just, Erickajoy was about leadership intentionality around this. And what do we mean by the words? We have to be broad about, when I say we need to name racism first, it's not the only form of exclusion. And we need to have an approach of looking at who is being marginalized systematically, and data helps do that. So employee surveys is a big one, and we measure that. We measure hiring. So we measure hiring from the communities. We have metrics and goals every year around hiring, purchasing goals, investment goals, and volunteering goals. This is for our anchor work. So from Anchor Mission, if you're setting this up, we found having a collaborative like you're doing, a big national collaborative around anchor work to be really helpful to, so there's this co-learning process. Within our employees, we're looking at the same sorts of things like representation, turnover, and some of the other employee metrics, but employee engagement as well around this. And we're looking at data on our patients by race, ethnicity, language, age, gender as well, to identify where we have gaps, mind the gap, and then focus on it. You can't focus on everything all at once. Where we have like I mentioned, the biggest work we have to do is in middle leadership. and giving people both the performance expectation, but the tools to improve representation and leadership. We've made demographic parity in leadership, meaning our leadership at Rush needs to represent the community that we serve as an organizational goal. But now we're at the place with how do you have this on every leader's performance, annual and semi-annual performance expectations. So there's that accountability, but as I mentioned, also the coaching, because we all, within all our organizations, there are thousands of different points of views, and not everyone agrees with the work, so we have to bring them along. But the metrics are important. Now these go up to our board, and we've done employee metrics as well. Employees who are making for us, $50,000 a year or $60,000 a year, we look at them as a separate group and look at their metrics for, again, retirement savings, financial distress. But we've also now created career pathways internally, and I know Advocate has done the same. So you can take somebody, so they come in at entry level, and there's an opportunity to move up in career pathways, and we track that data as well. It's not typical healthcare data, but it's essential to doing this work.
Thank you, David. Just one more question for you before I come to Joyce then is, I mean, this is an unfair one and you'll probably say, no, you can't, but can you point to a single or a couple of specific interventions that have had big impacts on this agenda in the community? And that could be within staff or it could be out in the community.
I will say our local hiring initiatives, tremendous success. We never focused on it before. We never focused on, and then what we realized is our systems for hiring in HR were never set up in a way to identify that young man or young woman who's coming from an economically distressed community, and preferentially, see, equity means those who, it's different than equality. Those who need more should get more. That means the food pantries in these neighborhoods should have more food, but it also means from a hiring perspective, we have to disproportionately aim our hiring to those communities. What we found is we needed to go out into those communities and put in kiosks so people could apply and help people to apply. And we can show success of people that we've been able to identify, and many, sometimes who've never had a horizon. And then they need to be supported in a different way when they come in. But we can show great success in that, of setting a metric, redesigning our HR processes, getting out in the community, just as an example, or investing in projects in the community that mean something to the community. We went from never doing it to doing it, or supporting local businesses with intentionality. And that some of that required us to pay them our usual payment cycle. Hell could freeze over before you get paid, but we had to change how we paid these businesses. All of it required an organizational redesign, and so many areas of success. And you just have to start somewhere, and you have to measure yourself along the way. And so you kind of like you're walking with a compass, and you just make sure you're walking in the right direction. I got to tell you the other side of it. It really knocked our socks off, and probably the same with Erickajoy with Advocate. When we started doing this work, it was the hearts and minds of our employees from these neighborhoods who have carried the senior leadership. And when we started doing storytelling, so it's really important, not with the data. We started with narratives. Everyone started with their own story today, but the storytelling. So we have, I am the West Side, so the West Side of Chicago, and stories of people and their experiences, and podcasts, and all of the stuff, because it's the hearts and minds that carry us. We made an employee resource group that are the West Side Employee Resource Group. These are people, not just from the West Side, who are organized around our anchor mission and what they need, and to address their wealth building desires. So a lot of pieces to this. Start anywhere, measure you along the way, celebrate your successes, but do things that are meaningful from an economic and career building perspective, because that's going to be the momentum that's going to keep people going.
Fantastic. And I'm popping a few resources in because we've got the Rush playbook, and I'll pop something in about West Side as well. And then there's the Larry Goodman interview too. So I've put a few things into the chat. So thank you, really helpful. We'll come back to you a bit more on specifics. So we've kind of talked a bit about the data, moving into initiatives and what people can tangibly do in their roles. Joyce, I'm going to bring you in. I'm sorry you've had so many technical difficulties. I think we've got you on the audio but not the visual. So Joyce, can you hear me?
I can hear you.
Fantastic.
As long as you hear me. I've given
up
on
you.
So.
Oh, I'm sorry about that. Let's try and persevere because you've got so much expertise that we're interested in. So you mentioned a few things about doing some audits around the policies and practice, and you come from a slightly different perspective. Our other two speakers are very much working in and with communities from a healthcare perspective, and you come from a different background. So tell us a little bit about some of the audits and what types of things you were looking for, and B, just a bit more about some of the specific interventions that you have been part of with the anchor partners that you've worked with, if that's okay.
Yeah, absolutely. Thank you. So just to share a little bit more about our audit, we received funding from one of our funders in the Community Development Network to undergo this process consultation, essentially, where we hired experts from Philadelphia, and this was a very diverse group. It was a team of 4, including 2 Black men, 1 Asian American woman, and 1 white male real estate developer, where they came in and with their various backgrounds in communication, business, and real estate development, and followed us around essentially in our day-to-day to say, okay, so what is the process in which you approach real estate development? And they did these big group listening sessions within our organization, with our board, as well as with community members directly. And what they found was that there was a very large gap in the understanding of what we did as an organization, as well as just in general, a very deep-seated suspicion around real estate development, as well as institutions. So many of the board members on our board were really excited. Innovation is the word that excites them. You know, like having new health anchors in the neighborhood is something that excites them. And then when they spoke with the community members, they said, well, those are all things that feel like they're not for me. You know, innovation is a word that feels very big and also comes to mind with a very specific image, right? Of maybe, white, Ivy League educated males who are ready to invest. And then with health, that was also, there was a lot of skepticism and a lot of broken trust between the medical community and our Black communities, just around not just access, but also just treatment and a lot of the systems within the health system. So we learned that we really needed to be much more transparent in our messaging and our communications directly with community members, that we needed community engagement in the front end of any process. So as soon as the real estate developer or as soon as the health institution was ready to move into the neighborhood or start to build something, we needed to include the community members and their networks into the conversation. And this was done beautifully by university hospitals. They, moved into the neighborhood with their women's and children's clinic. But what they did immediately was they formed a quarterly citizens advisory board that gave direct feedback, not just into the programs that would be running out of the hospital, but even the design. So what creates a welcoming atrium to community members? And what is the artwork that might be represented within the institution that would help you feel welcome? And at first we had all these Cleveland, baseball, panoramic views of the city. And some of the community members said, look, like there's not one image of a person of color in any of your artwork. Like it really needs to be reflective of what I think as my environment is. Even to the decor, there were a lot of natural elements of trees and grass, and it was 100% reflected of these like forest and rural images. And community members said, look, nature is amazing and we need to have that, but we need to have some images of the city in in some of the in some of the pictures and the art. So just to recap, it's really about the front end community engagement, transparent messaging, and direct connections with community members.
So important, Joyce, and thank you so much for bringing the community voice in such a way that really makes us pay attention to specific things that you did, and those things like you're talking about the artwork in the place, that those things that are the artifacts of the culture. What are the things on the walls that speak about what is important to us? And if that's the baseball stadium, then like what's that saying about our institution? So I think that's so powerful and something we can definitely all think that resonates with us. I want to stay on that kind of topic of culture with everyone really, and I guess what we're hearing in the chat is that people are thinking you guys are doing some amazing work, but this is absolutely hard work. And how do you do that and overcome some of the cultural things that are ingrained and the resistance, and also maintain resilience and hope in the face of setback? Because this is stuff that has been entrenched in the way in which not only the organizations work, but society as a whole operates. So thinking about how do you maintain resistance and overcome challenges, and in fact also what have been some of the biggest challenges? So quite a broad question there, and I'll go around in turn in a few people. So let me see. I'm going to go to David first, and then back to Erica, and then Joyce. So yeah, kicking us off, David, some of the challenges, some of the cultural change, etc.
Just to say, when we started off, I'd been at Rush for over a decade, and I always felt as even a white doctor that Rush was like a white institution. I mean, and my own image of it, back to what Joyce mentioned, and like, even though we serve a lot of the majority of our patients are Black and brown patients, I always felt it's kind of being this sterile institution with no community relationships. And then when we started this work, we realized we couldn't do it alone, and we created this racial health equity collaborative called Westside United. 6 anchor institutions partner with the community, sharing power, deciding on how resources we're going to get deployed. So a racial health equity collaborative focusing on reducing the life expectancy gap around in Chicago by 50% by 2030, a big, ambitious goal. And we launched that in 2018. So in 2016, we said we're going to do this. 2018, we launched Westside United. And of course, 2020 came COVID. And what happened during COVID, I think, was just, really awful, but it reinforced how important this sort of partnership is between, say, an anchor healthcare organization and community anchors and community leaders in facing adversity. And Westside United was asked to co-chair a racial equity rapid response team in the mayor's office with all the major healthcare organizations around that racial equity rapid response table, all the community anchors, and all the federally qualified health centers around a common table. And it really demonstrated the strength of the model. And I can't tell you, there was not a more optimistic table to be around in the midst of the pandemic. And while the hospitals were thinking, so this is where listen to the voice of the community and do what they say. So the hospitals, if you remember, everyone's saying ICU beds and ventilators. The community was saying, we need food, we need rental assistance, we need masks. Stop talking about social distancing. That doesn't mean anything in our neighborhood. And even things that we thought about when testing, we need testing. So when we sat around the table with the provider group, with the community group, we said, well, testing should be for symptomatic people. And the community group said, are you kidding me? Anyone who wants to get tested gets tested. What vaccination? We said 1A, 1B, 1C. The community said, anyone in our families who show up for vaccination should get vaccinated. And Chicago's equity framework for how to deal with the pandemic was dictated by the voice of community leaders representing community anchor organizations. And it's, again, a powerful testimony to the strength of the model. And again, a storytelling, but it's fact. In Chicago, third largest metropolitan area in the country, but about ninth in mortality. We had a terrible pandemic and still in it, but we did better. We didn't do great, but we did better because of the way we've organized around it. And so what's true within an organization is true in terms of these partnerships. And you hear from Joyce in Cleveland and Erickajoy, with the advocate system as well. They're difficult partnerships to maintain. I mean, there's a lot of work that goes on, but the outcomes are so much greater than you can do just by focusing on healthcare quality, for example.
Great, David, thank you. And really good to bring COVID in because it is so important and poignant. And I think for us in the UK, many people feeling a watershed moment about how they start to have different conversations with the community and really bring equity in. And vaccination has really brought equity in as a common conversation now. So hoping we can galvanize on that. Erickajoy, let's just go back to the challenges, the resilience, the changing some of the cultural, the structural things. I mean, we talk about structural and institutional racism. These are big topics. Tell us about what you've overcome, tips for other people, tips for managers, tips for colleagues.
Yeah, I think some of the challenges, a few that come to mind is one, just pace. Like this work is not for the faint-hearted. It can fatigue you. So managing the pace of the battles and the conversations and the challenging spaces that you find, particularly when you're challenged with those who contest the work or the need for the work. Even when there's debates around data, people will debate or rationalize out the data. Like it's that because of this, and it's that can be, that draws your energy, you know what I mean, to have to for this like proving, process. So I think you have to go in understanding what is it going to take for me to do that, and knowing that, back to storytelling, bring the stories behind those numbers. Every gap and every disparity and every number has a life behind it. And so I think when we're able to bring people closer to the experiences and that understanding, it does help. The resiliency, it does come through. Just yesterday, I had the chance, so I did a live real talk with my CEO. Very interesting. But we were going to have a candid discussion about race. The case verdict had came out the night before, and I got love mail, and I got not so love mail, last night. And I have to, like, my father used to tell me, buck up, kid, you got a race to run. I have to say, well, I'm in the game, but I'd rather understand where people are coming from. Because to me, Dominique, the head nods are the most dangerous ones. So in my previous, career, I worked in corrections, and we said this thing, we read the face sheet around the inmate and their PSI, their pre-sentence investigation report. And I would know the inmate I'm about to encounter with, right? I would have kind of their background. And I missed that. I missed a few things about prison. Remember, worked there, didn't live there. But I missed a few things of understanding where people are coming from. When you don't know, I don't know how best to engage. So I can take any kind of resistance, but I'd rather someone be forthcoming. And I think at that point, we have to remember, we don't arm wrestle people. We try to share with them as much as we can for a bit of understanding and to get there. And then I think another challenge of overcoming is multiple priorities, right? People will continue to say that this work is a competing priority, but getting them to understand it's already the work we're doing. We just have to look at that work differently and understanding how do we manage those expectations.
Thank you, Erickajoy. Really helpful reflections, and the head nodding bit just got me, and I was doing it, so I need to stop that. You're absolutely right, though. Joyce, just coming to you then, a bit on the challenges, and I might bring something that's come up in the chat about anything you're happy to admit around some things where you failed or things didn't work quite well. And I think sometimes it can feel quite challenging or tricky to know where to start with community engagement, and people do get it wrong. And so are there any examples that you're happy to share about failings as well as challenges, Joyce?
Oh gosh, I will circle back to that one. Just in terms of reflections on what challenges are in moving the needle, I'll just say, just industry-wide, I think one of the things that has been most apparent is that when it comes to structural racism, everyone seems to have a different understanding of our history. specifically in the United States around, it's very polarized right now in terms of what exactly is the experience of racism. And one thing that was pretty remarkable was there is a group of folks here that have brought in trainings around racial equity. And this is not about culture training. It's not about diversity training. This is really about educating and getting on the same page about history, these 2-day seminars. And remarkably, I think over 4,000 people in the greater Cleveland area have gone through these trainings. So now at least there is sort of a similar language and level setting. And I would say organizationally, that's probably one of the biggest challenges, is making sure that folks that are in leadership and leading the way have the similar understanding. With regard to challenges, you might have to come back to us around that.
I can come back to you. I'll give you a little bit of thinking time there. I'll go to David and Erickajoy and come back to you. David, Erickajoy, any things where there's been some failings where you've thought, we wish we'd done this differently, or we realized as it was happening we needed to do something different? Because this is never perfect, is it, right? You're always testing and trying. Erickajoy, you're nodding, not the dangerous nodding, the good nodding. Go on, you come in.
Good nodding, lesson learned, Lottie. And so I'll take a patient at team member 1. We were, excited that we were going to hold greater accountability around diversity and inclusion. And we launched metrics tied to our incentive plans, right? And so, it's big when you're holding people's vacation money and tying it to work around diversity, equity, and inclusion. And I wish we would have led with more education and information, because people saw it as we're just doing a black and brown thing, because we had diverse slates, we had supplier diversity, and we had patient experience, and not giving more of the why behind the work. And to me, that I had to own that, owning, understanding, getting more of the why behind out there, and sharing the information so people could become not threatened by the metrics, but a part of a bigger picture of accountability. And then from the patient side, where we were working on our LGBTQ strategy, this brilliant idea, I'm going to build this LGBTQ focused clinic, and it's going to be targeted, and we're going to have these, the signage and everything. And I forgot how you said it earlier, David, but I ended up creating this binder because all these wonderful ideas weren't what the community wanted. And I made this binder for myself in rainbow that said, for us, with us. And I told my team, we will not build this strategy without the insights of the group. There were concerns. People said, well, we don't want an isolated area. Why can't you build it into the mechanisms of all the operations? Like, why should we have to be fixed to one address versus understanding, premier care for the LGBTQ community? So those were my ahas. And I think it just goes back to listening first, understanding, seeking to understand before, proving to be understood.
Nothing about us without us, as David would say. Thank you, Erickajoy. David, I'll come to you, and I'd like you to reflect on the kind of maybe the failings is the wrong word, maybe it's learnings question, but I'm also going to bring in the final question that I've got in the Q&A, which is about a recent report that came out in the UK, which you may be familiar with, which was a commission on race and ethnic disparities, which created a lot of controversy in the UK recently, that looked at the state of race relations and why so many disparities exist. And whilst confirming that racism is in real force in the UK, the report's overall findings were widely condemned because it was seen to be minimizing and rejecting the role of sort of structural racism and inequalities. And I know you've done a lot around structural racism. So if you want to comment specifically on that report, or more generally about your kind of advocacy role as an anchor in terms of structural racism, and any learnings or failings. So just wrapping that up into a kind of quick bundle of a question there I throw at you at the end.
I'm going to start with doing this work, what you need. And Erickajoy said things, first understand and seek to be understood, right? And it's better if you understand what you're up against first. And you do that by asking lots of questions of your, whether it be of your community or of your opponents. Who's going to do this? So understanding what you're up against is critically important. When I describe myself, all of the things I describe, my big why, that I'm a human rights activist. Why I do what I do is for human rights. And so, every day I put my armor on to fight for human rights. The other thing, as a doctor, I know about behavioral change. Erickajoy is organizational change, but individual patient behavioral change is an insight into this. That, in other words, most people who quit smoking or quit drinking or quit drugs or some other eating fail multiple times before they succeed. So I look at failure, and we've had many, many of them, as an opportunity to look in the mirror, to ask more questions, to decide, is this the right thing to take on now, but map out a journey on which you have no doubt about failing, but I don't look at them as failures. They are opportunities for improvement. And so yes, there are many things we haven't succeeded on, and it's usually because we didn't execute. It's either the idea wasn't the right idea, but oftentimes the idea is okay, but it wasn't the right time, and we didn't get the right number of allies around it. And so that's what I say. I can enumerate them all for you, but I actually think it's okay, and it's okay to publicly talk about them, and to use them as the story, and then use it as an opportunity to inquire, well, how could we do it better? To think that we're going to do this on our own without the voice of the people, whoever the people are behind us, is naive. But if you can engage that voice, including listening to those who are in opposition and understand, that leads you to success. And then you got to celebrate the successes, even the small ones, because they are, again, I look at it as we're a little compass, and we're trying to find our path. And when you find that next place on your path, celebrate it and build the momentum within the organization. And the last thing is, you can't do it alone. You must have, and Erickajoy said, your allies have to be all across the organization at all different levels.
Listen, we could talk forever, and I'm sure there's many questions that we haven't managed to ask you, but I hope that we've got through most of them in the chat. I think I'm going to just come to each of you now to just say anything that you want to really make sure that our participants hear, that you feel that I haven't given you the chance to sort of say. So I'm going to come to you first, Joyce, just to, you might want to pick up back on that sort of failings or learnings piece, or you don't have to, no pressure to, but just some final key parting kind of messages for people as we kind of close the session. So Joyce, over to you, and then I'll kind of go around the other two members too.
Absolutely. And David, you actually hit on what I was going to talk about regarding failings is, I think for us, our organization, we tend to be very optimistic and really celebrate all the amazing things that are happening in our neighborhood and among the institutions. And I think that, it gives an impression of like, things are always great. Things are always great for this, historically white institution, and never really talking about the ways that we have failed, or the grants that we did not get, or the projects that never went underway. Having a two-way real dialogue with folks really makes a big difference in humanizing our institutions and organizations, and making them more just real, that we are also real people and real organizations. In terms of my last few thoughts, I think one thing that we're really being challenged by now is really thinking through not only just infrastructure and place-based solutions, but really challenging both our own institution as well as the other anchor institutions around, to really think through, what does it actually mean to do restitution work? What does it mean to do reparation work? Especially as many developers and institutions have sort of capitalized on the lower property values that have depressed because of the unfair property valuation of Black and Brown communities. And so I think we're really pressing into that. And I think the biggest thing that we are sort of asking ourselves is, what does it mean to do right by our communities? Not just because it's the sort of theoretical thing, but because now we're friends and neighbors. And we know our community members because we have a direct relationship with them. And so I'll leave it at that.
What a wonderful way to end us up thinking in such accessible language in terms of what does it mean to do right by our communities, because they are our friends and neighbours. And sometimes these notions of anchor institution can feel very sort of power dynamic imbalance. And so this is really important. David and Erickajoy, anything else you want to add that you can't live without saying before we kind of close this session off?
I'm going to say 5 years ago, not knowing how to proceed, moving from being a chief medical officer and a doctor to move into urban planning and organizational development change. Not quite like being in prison, but you know, Erickajoy, similar in a way. We we helped found the Healthcare Anchor Network in the United States. I thought that we needed something to help pull us along, and we did another project with Institute for Healthcare Improvement called Pursuing Equity, because I felt like these are push-pull strategies. When you start doing it, you're pushing it, but for them to succeed, they have to be pull, and I wanted that outside pull. It was the smartest thing to do, is to get help. So as you're doing this in Great Britain, we're here, we're only a little bit ahead of you. And believe me, we haven't solved the problem. We need this whole table of problem solvers together. Imagine what we can do internationally together. So that's kind of what I am. I'm amazed we're here, you know, and I'm optimistic for what we can do together. I feel really lucky, because if it wasn't for the decision of a grandfather and grandmother at 20 and 19, didn't know each other, met in a room, my grandmother didn't even know who she was going to marry, to a 19 and 20-year-old, I am here. So, you know, there's work to do. It's a lot of work, but we can do it better together.
Thank you. Absolutely wonderful sentiments. Our power team, which is, I think, a phrase Erickajoy used in our green room. So Erickajoy, power team here. Any final things from you before we close?
I guess let's make it really quick. Relationships matter in this place, in this space.
Yeah.
The relationships you need to have like a circle like this to learn from, relationships that need to be established so that you can influence, or relationships that need to be repaired and restored so that you can move things further. So make relationships work for you.
Thank you. What wonderful, inspiring messages, journeys you've been on. We really appreciate your honesty, your expertise, and we hope that you will see us as friends, allies, colleagues to learn from and be sharing with. We've got just one task left for the group of people who've joined us. I hope you can fill out the poll. It's really important to us. These people have given up their time to talk to you, and we want to know that this was useful or things that you'd like more or less or different of. And I've got one more slide. So please fill in the poll. And just to say that this is not the last in our week's events. We've got a couple more things tomorrow. We've got a virtual coffee networking session at 9:30. If you want to chat more about these types of topics, please do. And a plenary session at 2 o'clock tomorrow. And make sure that you go to our haln.org.uk link to book a spot on any of those things. Bueno, are there any more bits from me on the slides? Is that the last bit? Please, yeah, please do fill in the poll. We really, really appreciate data. We've talked about the importance of data. So please pop in anything you're going to do, anything you've picked up, or just do it in the chat and thank everybody. But absolutely wonderful session from our speakers. Thank you so much for joining. And thanks to all those who teed it up to help prepare us for meeting up here.